Thank you so much, Neil, and thank you for inviting me, Shelley and IPSO. Well, it's a very interesting topic, aging in Prader-Willi syndrome, and what can we expect? And perhaps you are coming today to know what you should expect, and then perhaps you'll be a bit sorry because I cannot say what will happen for all your clients because they are all so different. But there are some things from medical point of view that we should be aware of. So I hope really that we can have a lot of questions and then we can discuss what what is going on all over, and we can teach each others and give information. So, well, my wish and hope is to tell that early physical aging is not a rule for all with Prader-Willi, and to give information about medical facts and possible treatments, and to avoid too early aging because of lack of knowledge about medical needs, and to secure a focus always on individual needs. And I think this is so important also with changes and aging. We still need to learn more. More research is needed about Prader-Willi and aging, and we must avoid false expectations that can arise without documentation. And you are the experts, as I said. So what we know, it is possible to have a long, happy and healthy life with Prader-Willi, and more adults are living healthy, happy with normal weight. Special support is always needed and individual realistic expectations. Family, caregivers, health professionals, we all need to know about Prader-Willi and to know about the diseases, how to react when specific help is needed. So we have to be aware that the adults today with Prader-Willi, they are becoming older, thanks to you, but they are different. They have very different backgrounds. Some have been healthy without diseases for many years, and some have had several illnesses, and perhaps they still have. Upbringing, family support before and now varies a lot. Childhood possibilities, school, social contacts, and acceptance vary all over the world. And the actual situation, illnesses, living situation, occupation, all this will influence on the aging process. What is sometimes wrongly expected, and this I really want to stress, that adults with Prader-Willi cannot survive healthy until old age, or early death is to be expected as it is for many congenital syndromes. And people with intellectual disabilities like Prader-Willi will develop dementia. This is wrong. We need published data on healthy aging in Prader-Willi, but we know adults with Prader-Willi who are healthy now and also becoming older. But what we have most in the literature are case reports about people with diseases and dementia. So we need more information about the medical conditions, also about those who died. So here I want to show you Sven at his 60th birthday. You see he did not have growth hormone as a child, but he's doing very well. He's healthy. He's living in a Prader-Willi facility, and I met him several times at the association summer camps for adults. Yes, 60. So when you are old, Prader-Willi and others, you are looking older, you have less muscle power, the balance can be weak, more weak than before, especially in Prader-Willi. There are more risks for diseases, need for help can change when you are not able to do as before. And mentally, you are in many aspects the same and still have more experience, but it can be difficult to manage with the challenges that come with age. And diseases in Prader-Willi, it can be really difficult because symptoms can be different and unexpected in Prader-Willi compared to others. Less pain with fractures and abdominal diseases, no fever with infections, and people with Prader-Willi cannot always explain their symptoms when they are ill. It's a great risk that diseases are overlooked and diagnosed too late. Many know cases with too late diagnosis, too late medical intervention. We have all heard about that. What we know It's a complex disease with many physical problems and symptoms typical for Prader-Willi that can arise. Today, we know how to treat many of the well-known medical problems. It happens that the medical problems are not seen then and not treated. And of course, this can also cause early aging or even early death. I want to point to a rather recent Dutch investigation that showed among 115 adults, 61% had one or more untreated health problems and 25% had multiple untreated health problems. And what was that? Well, in one of 4 patients, they had multiple undiagnosed health problems simultaneously. All men and almost all females had hypogonadism. 75% had scoliosis and 18% hypertension. 19% hypercholesterolemi, comes with overweight. 17% had type 2 diabetes, also comes with overweight. And 17% had hypothyroidism, which is easy to treat. And unfavorable lifestyle were common. 22% exercised too little, and 37% did not see a dietitian. Striking. And then what was the causes of death in Prader-Willi for other surveys? Overweight, respiratory problems, lung infections not treated because no fever, we have seen that, apnea, abdominal diseases, infections, and stomach rupture, accidents also in traffic, choking, breathing is blocked by food in the throat, but often no information about the actual health status of those above who died. So how were they before they died? What was their problem? What were their problems? And then often it was reported that it was a sudden, unexpected death, and often no reason found and described. Well, perhaps in some old surveys, but again, this sudden, unexpected death is still reported around. So more research is needed. There's only one brain study that I could read about. It was an MRI study, found that the brain ages in adults with Prader-Willi, the ages is advanced for age. But the participant in this study had different backgrounds and medical status. So is aging different? Also when correct medical treatment is given? Sure, I think it is, but it makes research difficult when adults with Prader-Willi have different backgrounds. And daily life, individual evaluation and correct treatment in acute situation and daily to avoid early aging because of diseases. So what to be aware of? First of all, the weight. And I'm not talking about diets. I'm talking about what can overweight result in. Diabetes. And diabetes is not only diabetes that you can give a tablet for, but it gives circulation problems, edema, heart problems, kidney diseases, and eye diseases. You can become blind. Joint problems, difficult to walk, breathing problems, low oxygen, poor general condition, sleep problems with apnea, daytime sleeping, and bladder control, and intestinal problems, obstipation, infections, and cancer. So it's really a serious disease to have because of overweight. And how to treat overweight? Well, it's needed with a gradual weight loss based on correct food and moving. And you should be supported by a dietitian who knows or learn about Prader-Willi. And to secure a correct plan for the diet, it's needed that you secure that there's enough protein, carbohydrates, fat, and vitamin D. And especially vitamin D, we have to stress that in many surveys, it's seen that people with Prader-Willi, they are not given enough vitamin D, and which is very important for many, many things in the body. And to have a plan for the structure of the administration of food and daily program for moving, of course. And then I want to say walking is possible for all. And when you walk, you are carrying your own weight, and this demands calories. But of course, other activities can be very good. So then there's a lot of hormonal things to talk about caused by hypothalamic dysfunction. And this is growth hormone deficiency. Many adults need treatment, I ask, we think. Hypogonadism, all men, most women, hypothyroidism, and then adrenal insufficiency, which is rare. So about these hormonal diseases, I will say not how to treat it. We can come back, and it is on my slides, but I just want to say about growth hormone, because we are discussing very much if it should be continued in adulthood. And in some countries, they even start growth hormone when older people at the age of 40, 50, it can be started already, also there. Because growth hormone is important for muscles and organs, also for adults. And you and me, we have all growth hormone in our bodies until we are 90 plus. And it does not affect appetite at all. There are different rules about growth hormone treatment for adults in many countries. And in some countries, some special tests are needed before start, but then start can be possible. We know that adults with growth hormone deficiency can have medical problems. Also, people who have growth hormone deficiency not having Prader-Willi. And surveys shows that those will have an earlier aging and earlier death if untreated. And growth hormone is giving us daily injections. And doses adjust after a regular blood test. So hypogonadism, low testosterone in men. You all know how they look, small genitals since birth, and no normal maturation of genitals in puberty. And if you have still, as an adult, insufficient testosterone in blood, as a man, it will show, well, in puberty, no growth spurt, and then no normal muscle growth in puberty, smaller than normal muscles in adults. And you will still have this high-pitched voice as an adult. You will have small genitals and very little body hair. You look young the first adult years, but then early aging, the result is that many then look old when they are around the age of 30. And then osteoporosis will arise, risk for fractures, and anemia can arise. So early aging and weak muscles are seen in men with low testosterone. And I'll skip this, how you treat it. You must ask your doctor. We can go back if you have questions. And also about women, it's the same thing, no growth spurts in puberty, no normal breast development, late or irregular menstruation periods, early aging, and osteoporosis. And also, a few women will have menstruation, often late and irregular, if no treatment is given. And all women are, in theory, we have to say, at risk of becoming pregnant. We have seen that. There are now reported, I'll not say many, but at least some cases. And treatment of women, I'll also skip this slide, but it will be published. And of course, the treatment of men and women with hypogonadism, it is possible to have this treatment by an endocrinologist who knows Prader-Willi, or a gynecologist for women. Hypothyroidism, it's very sad if it's overlooked, because it can result in less muscle power, losing weight, muscles weight, feeling cold, slow heart rate, being slow, no energy, and very early aging physically and also mentally. And well, I'll not say much about the treatment, only to say it's very, very easy. It's only a daily tablet taken half an hour before breakfast. And adrenal insufficiency, it has been talked about, but it seems to be rare. But it's, of course, the adrenal hormones are important for the body to react normally when we are ill. So it is recommended to measure the adrenal hormone cortisol with blood test in acute situations. And then I just show this photo. I had it from Lynn Gehrig from United States, and it is to see how osteoporosis develop, how in a microscope the bones will look, and the causes again can be hypogonadism, but also reduced activity. And also it can be inherited from the parents. There are in some families that there are many, well, otherwise healthy persons who have osteoporosis. But it's more often seen in the healthy population in women, but here it also seen in men with Prader-Willi if they have hypogonadism. And the risk is, of course, bone fractures, and it's recommended for all to have a DEXA scan to evaluate the bone structure. And in some countries, it's done every second or third year, depending on symptoms and what you find with the first DEXA scans. And then another thing which can be difficult to understand, it is the autonomic dysfunction, because it is, so to say, our inner nervous system, and we cannot control by medication. It works by itself, you can say. It's called the sympathetic and parasympathetic nervous system. What it is, what the work of these systems are, it stimulates and regulates our bowel and urinary system, our blood pressure, sweat, blood circulation in organs and skin, and also influence on the sleep and the temperature with diseases, fever or not. And nervus vagus is important for the autonomic system, among other things. So there are more things to be very much aware of, because chewing, swallowing, and teeth, mouth, pharynx, and upper esophagus, the muscles here are weaker than normal, and some are not chewing the food sufficiently, and then a risk for choking. Food is often not swallowed normally when you have Prader-Willi, and also your saliva is often seen sticky. And after a meal, some, or many, I think, has food in the mouth, pharynx, and upper esophagus. So think about when meals finish, they still have food in the mouth, pharynx, and upper esophagus, and you and me, we do not have, because our muscles have pushed this food down to the stomach. So advice from my side is drink half glass of water when the meal is finished. And then think about gastrointestinal reflux is rather common in Prader-Willi, and sometimes because of the high pain threshold, they don't feel it. We other persons, we will feel this reflux if it happens, and it can destroy the teeth by the acid from the stomach. Constipation, we are talking often about it, and it's a very common problem. And it has something to do with this autonomic nervous system. It's a slow intestinal passage, which is the case for many adults. The result can be severe constipation, sometimes so extreme, so it causes vomiting, which is usually not seen in Prader-Willi, also because of the weaker muscles in the upper part of the intestinal system. The cause is slow movement of muscles in the intestines, and laxantia can help, and the dietitian can prescribe the best diet. I will say the best diet, because for some persons it's a very big problem. And constipation can affect mood, alertness, and general well-being. So this you perhaps know. And of course we aim to have type 4 stools. Sleep and sleep apnea. Sleep investigations have shown that sleep pattern can differ from normal, the different sleep phases that we have. Sleep apnea, breath holding during sleep, can be central or obstructive. And again, the nervous system, central sleep apnea is abnormal regulation from the brain. Obstructive sleep apnea is caused by enlarged tonsils and adenoids. So if you experience snoring or sleep apnea, then it is recommended to have a sleep investigation and also evaluation by a so-called ear, nose, throat doctor. Some will need CPAP treatment, and narcolepsy and cataplexy can be seen also in Prader-Willi. So again, another investigation, about 60 adults with Prader-Willi. Many adults were reported to be more sleepy than others. And this investigation showed that 60 adults with Prader-Willi, men and women, most were overweight, and 67% had excessive sleepiness, some with narcolepsy, which is sudden sleep when you're just sitting and then you drop your head down. 15% had sleep breathing disorders, and 14 persons had obstructive sleep apnea. And among these, some will benefit from CPAP or special medication for narcolepsy. And then not to forget the back and the muscles, and many have scoliosis or kyphosis, and children are often treated with bracing or operation if it happens, if it's seen in the teenage years. But many of the adults today are not treated as children and can have back problems that causes with age more and more stiffness and also pain. So first treatment is a contact to a physiotherapist that prescribe exercises to be done daily at home, supervised by staff. And I'll stress that because you cannot just order some exercises and then think that the person will understand how to do it correctly. And of course, a contact to an orthopedic surgeon if you speculate if something more could be done. So this is pictures of the normal spine, kyphotic spine, and scoliosis. Edema and skin infection in Prader-Willi is often seen also with normal weight. And this is caused by insufficient lymph drainage and poor circulation. And the treatment here for the edema is supporting stockings, walking, avoid long hours sitting. And diuretics are only indicated for lung edema caused by heart or lung problems. Risk of skin infection can come with swollen legs and potentially life-threatening. With severe overweight, edema can be seen in the whole body and lungs. Diuretics given if there are heart and lung problems, but not only for edema. But treatment here, of course, is weight loss, walking, moving, and elevation of legs, of course. Then I will not say very much about behavior. I know that it's a big theme for many of you, but I want to say that, well, I'm not a psychologist, I'm not a psychiatrist. So you see my focus is very much on the body, but to my experience, I think that many behavioral difficulties arise with changes, family relation or loss of family, changing of staff. I think this is very often seen, and of course many other things. Misunderstandings, if you have given a message that was not understood, too high expectations from family. Well, I want to say some families have too high expectation that give behavioral problems, or from staff. And grief can come late. If they lose their parents, then the grief reaction can come after half or 1 year. So difficult behavior demands personal support, often extra support, and difficult behavior is not a wish for the one with Prader-Willi. I think it's important to say. Difficult behavior is painful for the one with Prader-Willi, and difficult behavior cannot be cured with medication alone. Sometimes it's needed to give some support with medication, but it's not a thing that you can cure with medication. A cure, it's not, well, it's not a disease. So what to do, always analyze what and when and why it happened. which changes were there, who were there of staff or parents, and what was really go down into details, minutes from minutes, what happened before the difficult behavior arose. Psychiatric diseases, of course, it can arise in all, and it can come in all ages, but you should be aware if there are changes in mood and behavior. It could be because of physical illness, and this should be ruled out first. Or, of course, it can be a psychiatric disease. Depression can be seen. Symptoms are primarily loss of energy. Dementia, this is primarily loss of skills. Psychosis can arise, and psychiatric diseases can be treated with medication, but it must be diagnosed correctly before you start medication. And medication must be started with low dose to avoid side effects. So this is something about dementia and depression. And well, these slides I also have from Lynn, but I have met more cases where a person had depression and lost energy, and then it was for some reason thought that it was dementia because it was a person with intellectual disability. So when you are dementia, you lose your skills, and if you have a depression, you lose your energy, to say it short. And this is also a scheme that I had from Lynn's presentation about aging. And this is, well, a recommendation to check, well, yearly or half yearly, all your cognitive, mobility, cardiovascular, and you can see it when the slides are published here. So it's a good idea to, on regular basis, go through all these symptoms with your adult clients. So I'm soon I shall finish, but what to do yearly for all adults with Prader-Willi, medical visits and blood tests, and of course more often if needed. So secure regular medical evaluation and treatment, and yearly at least evaluation of the diet, and it should be individualized. You cannot serve the same amount of food to a group of persons with Prader-Willi of very different size. And then blood test for the blood sugar level. Is diabetes on its way? Hormones, vitamin D, calcium, and then of course other investigations like sleep studies and DEXA scan. And not to forget dentist. Vision, need of glasses when you become older, also me. Hearing, also when you become older. We all know persons above the age of 40 who need hearing aid, and it can happen also with Prader-Willi. We know that most of them have a very good hearing when they're younger. And then in difficult situations, insist for medical evaluation when you meet no wish to eat or vomiting, then there's something really wrong. Being ill is behavior suddenly different. Swollen bones, ask for fractures even if there's no complaints about pain. And then have this one page with you. You can find it in all language on the IPWSO website. And beside, there are the medical alert booklets also on the IPWSO website, and you can have it in many languages, and you can bring it with you when you travel. It's good to have documentation with you when you go to another country. And then I think perhaps this is the most important, write a yearly report, the yearbook, and then print photos. It's so nice for the old person with Prader-Willi to have photos of what happened before. You can talk about it. Also to have photos from the family that are perhaps not there anymore. Write down what happened during the year. How was the physical and mental function, the family contact, loss of skills, any diseases. What did you enjoy and what do you want to do? So, well, just greetings from Denmark. You have here my two sons. You see the one with Prader-Willi, he had growth hormone, and he was almost as tall as his brother. But if he did not have his scoliosis, he could have been as tall. So, and this is where he is in Fejø, Denmark, and you can see all the apple trees. Fejø is famous for the apple trees, and my son in his favorite position. Thank you so much.